Well, Molly Coye, it is just a pleasure to have the opportunity to speak with you about your previous history with the Institute and with Phil Lee. And thank you for taking the time to meet with us today. Molly, I guess the first thing I should do is clarify what your current position is with UCLA. Can you please tell me a little bit about your title and your current responsibility?
Well, I have a very unusual title. I'm the Chief Innovation Officer, which is a fairly new title, and it covers a multitude of sins. You really can do almost anything you want to under that rubric. I'm responsible actually for finding the accelerators that will really speed UCLA, the health system, the delivery system, to the transformation that it needs to make for the future. And that's very different. We're not involved in commercializing gizmos. We're really looking for the new ways that could catapult us ahead in trying to transform healthcare.
That is quite a formidable undertaking.
We have a lot of help. Any university is full of people who've been thinking about this and working on it, so there's a lot to draw on. But uniquely, UCLA is also very willing to look at outside sources of innovation. And that's, I think, a transformative change for most academic centers.
I see. So is UCLA partnering with many external organizations? Or?
Yes, we're working not only with other academic institutions, but also with community health systems that are really doing novel things, and also with community service providers. So we're working in projects where the lead is actually a community services agency. And that's a new experience for a lot of the medical center faculty.
No, that's fascinating. So this is a very new direction, and I am curious, is it the case that you have sort of established goals over the next several years, or are you kind of inventing this as you go along?
I guess the best answer is both. We do have a very clear idea of the kinds of things we need to do. I mean, the major challenge around the country is that we aren't going to have, actually let me stop, I'll just take another run at it. Actually, the answer is really both. We are going to continue to have to modify sorry, I hadn't prepared the answer to that.
No,
let me
I'm
try
sorry.
one more.
No,
it's okay.
No,
it's okay.
But I think
take a moment.
Yeah, no. Let me just take one more. Take another run.
That's part of the fun of this, because you can get to put your own flavor.
Yeah,
your spices.
Right. We're pretty clear about the goals for the Institute, and we know that this ties directly into our strategies and the challenges that academic systems are facing. That if we don't broaden our base and make sure that we are actually competitive with the community systems that are the largest and best run in terms of the value of what we offer, we can't sustain ourselves just with the quaternary care. So that means we really have to make primary care, secondary, tertiary, every piece of our offering much, much better.
That's fascinating.
Yeah, let me add, or take you might take clips or something, because there's some other points that are important. I've been working with lots of the new innovation and transformation officers and centers around the country, and it's very clear that at least for a big subset of us, the biggest challenge is not just thinking of ourselves as a delivery system, but as a way of meeting the needs of the patients, the families, and the communities for health. And that's a public health question now all of a sudden arising in policy and in delivery systems. So my goal in the Innovation Institute at UCLA is to have public health and policy merge with the concerns and the need to change the actual delivery of care. So I'm drawing on all the background, including the Institute.
Well, you are eminently well qualified after your public service in government and in the private sector. And I am wondering if you might tell us a little bit about how you first connected with the Philip R. Lee Institute for Health Policy Studies.
Well, I'm not sure it actually had its full grandiose title when I first had contact with it on 3rd Avenue. But I actually came to Phil very early on because I'd been in China studies, and I thought I wanted to go into medicine, but I really wanted to change the world. And how did you do that as a doctor? And he helped me understand the intersection of policy and politics and medicine and health. And it was so inspiring. He was one of my main mentors early on.
And in a certain sense, I'm wondering what the influence or the motivations were that might have sprung up from some of a part of that early relationship that took you in the direction of public service, of policy, and of really, you worked in the consultant arena, and now in technology and innovation. You've really run the gamut in terms of your spheres of influence, shall we say.
Some would say it's a very checkered background, but it's been wonderful. And I would say the common denominator is really something very consistent with what Phil and the Institute bring, which is looking for the levers of change. That in every situation, there's so much need for change in healthcare. It's looking for what are the policies, what are the new programs that could be advanced that will get us to what we know we're capable of.
Well, I'm wondering what your biggest challenges were in terms of your policy experiences as you look back, and what you found most helpful in terms of enabling you to pursue and endure your passion.
Mm-hmm. Well, it's interesting. Let me start again. In preparing for talking with you, I actually went back and thought about the Institute, and it turned out that I've had fairly meaningful influence. Let me do it the other way around because my grammar's twisted up. In preparing for the interview, I actually went back and thought about it, and it's every 10 years or so, I had contact with the Institute that really shaped the work I was doing and the way I thought about the role I should play in the world. The first, of course, was talking with Phil when he helped me make the decision to go to medical school. And he actually wrote me a letter of recommendation, which I still treasure. 10 years later, I was finishing my training and going to work for the government, for CDC. And I was in San Francisco, so I could be around the Institute and go to events there. And it gave me a much broader understanding of the role of government and what we were doing there. Then when I became health commissioner in New Jersey, John Eisenberg asked me to come down and give the alumni address for the RWJ scholars, and my talk was straight out of the Institute playbook. It was how to use data to drive policy, because I was really finding out how hard that was to do. And then I would say 10 years after that, when we did the IOM report on crossing the chasm and to err as human, that was really defining the policy changes that would be needed, private and public, in order to improve quality. So it's been like clockwork.
I'm wondering, Molly, I don't recall specifically, but were you in a situation where you collaborated with Phil on anything in particular?
No, we never really did. Yeah.
I know you used him as a resource at many junctures in your career.
One of the things that was the most fun is in the mid-90s all the way through the 2000s, that's too long. One of the things that has really been fun for the last 15 or 20 years is that Phil was always fascinated by new approaches. So I wound up advising venture investors and working for an IT startup and really looking at what were the new things that were possible that you might want to introduce. Phil was a great source of it. He was really interested. So I think the Institute had some very interesting influences.
There are several people that we've spoken with who have commented that on some level they were more confident in pursuing their path, even though it wasn't a totally traditional or known path, partially because Phil had so much confidence in their abilities. And I'm wondering if you can recall and look back think about your early interactions with Phil and how that impacted you.
Well, I definitely think Phil shares some of the blame because his life was a great model for many of us. He was not fazed by the idea of taking on something new, something unexpected. And he also did something which is very important, is he spoke truth to power, even as he held power. In many situations he was in, he used evidence, he used information to really push and shove. And that was important. I mean, that I think influenced many of us too. Do you want me to do another, because that came out a little harsher than I meant on the push and shove business?
Yeah, let's do another one.
Yeah, okay.
Okay, so.
Well, you can always choose which you want in the future. But, well, look, Phil has got to take some of the blame for many of us having very checkered careers, because he was never afraid to take on something unusual, and certainly to try many things in his career. And it influenced all of us. And I find, now I got off track, it influenced all of us. You could stop it there. Okay.
So, I think with regard to this question about it, did your experience at the Institute influence your subsequent working career, we've really kind of woven that in.
Maybe if you ask the question about when I was health director in California, what did I call on the Institute for? Because that was really after Phil was no longer, or it was, I guess, when did he leave as director?
He went to DC in 94, 95, when he went back for the second time as assistant secretary. You know, Shalala was his. So, Molly, I'm wondering if you can look back and basically share with us what your experience was when you were in California and in public service, and whether you had an active working relationship with the Institute, and tell us a little bit about that.
Well, I was director of the health department in California in the early 90s, and we had contracts with the Institute, and I turned regularly to Institute leaders for information. I mean, we looked at the big battles we were having about HIV policy then. These were some tough issues about immigrants, and some of those were so tough that the Institute was invaluable because we needed real facts, real information, and informed expert opinion. So the interplay with policymaking was very strong.
That's wonderful. That's great.
I just want to get a clarity on that. So how would that relationship work? You would rely on the data that the Institute provided?
No, the Institute was we had a whole bunch of activity in the area of HIV.
In the areas where the Institute had expertise, we would write contracts with the Institute, both to do some studies for us, to review the areas and make recommendations. We relied on them a lot.
Okay, so maybe we can get a quote out of that.
Okay, so Molly, when Phil was president of the Health Commission, were you up in Sacramento at that time? That probably was later.
That was later.
Yeah, I'm just trying to think about the chronology.
I was out of state government then,
Okay, so I'm trying to think what would be helpful here. Let me think about how to phrase this. Actually, you know what, this might be. Suppose we address it in the context of the value added of the Institute. You can use that as an example. Okay, so Molly, I'm wondering, looking back on your experience over the decades with the Institute, what you think the value added is of having the Institute as a resource and having a network of colleagues there.
I think the whole the world of policy making today is very different from 20 or 30 years ago. 20 or 30 years ago, most policymakers didn't have very many people as researchers, and certainly not institutions to turn for the kind of guidance you can get from the Institute. Today, there's a growing number of them, and certainly in Coye, which I think is sort of a child of the Institute in many ways, is evidence that the world has really progressed, that policymakers understand there's a real contribution to be made by health services research and its use in public settings. So that's probably enough right there. My own experience, let me do one other thing. When I was health commissioner in New Jersey, there were some areas that we had to make policy in which there really wasn't a lot of guidance from health services research. That left the field open for wild assertions. And I used to love a stanza from the Talking Heads. Facts, oh shoot, you're gonna have to cut this in because I have to think a second for it, but it's facts, oh yeah. Okay, I'll start again. When I was health commissioner in New Jersey in the late 80s, there weren't very many places like the Institute that actually could provide not just data from research, but actually a very informed and thoughtful point of view as guidance for a policymaker. So in some topics, that meant that the field was wide open for very crazy ideas. And I used to love a stanza from the Talking Heads. And they said, facts all come with points of view. Facts won't do what you want them to. And I've always thought that was a really good statement. We need real, hard facts and understanding in order to guide us.
That's great.
That's very good.
That's good. So this is a question that Lauren talked about, and let me just read it to you, and you tell me if you think this is worth, pardon me, our sort of using again, because MJ may be able to. For a physician who wanted to move into the policy world and was so successful in doing so, but who actually had a very varied career in addition to several major government positions, the consulting arena, health technology, systems innovation in an academic medical center. How do you view the contribution your experience with the Institute made to all these various roles you have played? I said to Lauren, give the woman a break.
Yeah.
But anyway, she's here in spirit.
Right. I think it is, in a sense, an intellectual conscience that the association with the Institute gave me and gives to many other people who go on either into the business sector or into policy making. It's knowing that it is possible to know answers to very tough questions, or at least to have much better information that you would without that kind of research, and that you owe it to yourself and to the people whose interests you're trying to serve to understand that, to seek that out, and to be very thoughtful about how it would shape your policy. So, Molly, I'm wondering if there are other questions that I should be asking you, or other things you want to share about either a look back, a look forward, about your experiences. This is a great occasion, this celebration, and I really hope that it's an opportunity to have an ever-widening circle understand exactly how terrific the contributions of the Institute are, and that we'll all build on that. Well, you could stop with R. Yeah. Okay. All right.
Very lovely.
Is that okay? I know you're only going to wind up using like 2 or 3 clips.
Nobody's ever done a summary like that.